So good evening, friends. We have discussed regarding the case taking in chronic diseases and especially how it is if we deal with the acute diseases. In last lecture, we have discussed few aphorisms which explains the what is the case taking, the mode of case taking in acute diseases in the aphorism number 99. And Hahnemann explained over there are very few questions which are needed to be asked in acute diseases because whatever comes is of a recent origin and it comes spontaneously from the patient. And that's why it's too easy to get the characteristics from the patient, and along with the characteristic we can get easy totality on basis of which you can immediately find it out a right remedy, right simillimum to the patient. The concept varies only little bit with the epidemic and sporadic diseases, and where he spent three aphorisms which we have learned in yesterday. He explained over there the approach remains to be the same even in epidemic and sporadic diseases. Every individual you have to take the case individually and find it out a remedy for that patient for the purpose of cure. In order to find it out the genus epidemicus of that specific epidemic, then you have to approach with many cases and you have to find it out the totality of the epidemic. And on the basis of totality of the epidemic, you have to form a remedy which is called to be a genus epidemicus, which is not curative for the patient, but which is preventive for the healthy persons to increase their immunity and to stimulate their immune system. That remedy can be used as a genus epidemicus. And this aspect we have discussed by taking different examples of COVID-19, then chikungunya, then swine flu, and how the genus epidemicus was decided at that time. That's what we have discussed in last lecture. Let us go ahead with the concluding part of this case taking. Very big and important topic which we are going to finish in mostly in today's lecture. We'll start with the aphorism number 103. What he says about the 103. In the same manner as has here been taught relative to the epidemic diseases, which are generally of an acute character, the miasmatic chronic maladies, which, as I have shown, always remain the same in their essential nature, especially the SORA, must be investigated as the whole sphere of their symptoms in a much more minute manner than has ever been done before for them, for in them. Also, one patient only exhibits a portion of their symptoms, a second and a third, and so on. Present some other symptoms, which also are but deserved as it were portion of totality of the symptoms, which constitute the entire extent of this malady, so that the whole array of symptoms belonging to such a miasmatic chronic disease, and especially to the SORA, can only be ascertained from the observation of the very many single patients affected with such a chronic disease, and without a complete survey and collective picture of these symptoms of the medicine capable of curing the whole malady homeopathically, to wit, the antisorics, cannot be discovered. These medicines are at the same time the true remedies of several patients suffering from such a chronic affection. So let us see what he wants to explain over there. Specifically, if these epidemics are coming again and again and patients are suffering from the similar types of manifestations one by one, or again and again, then definitely the chronic miasm lurking behind is there. Generally, it is always a SORA because acute explosion of the latent SORA is the reason behind the acute manifestations and acute diseases. In such types of cases, when you deal that patient is suffering from recurrent epidemic disease, then you have to find it out the antisoric remedy for that patient. Then how to find it out antisoric remedy? Already we have discussed how to investigate a fundamental cause. We have discussed while discussing the aphorism number 5. We have discussed 7 points which are very important in order to investigate the fundamental cause, that is the sora. What Hahnemann explained in that aphorism is very correct, and with which you have to approach to find it out a right remedy. But sometimes the patient's futures are so indicative of the miasm, even though they are not numerous, they shows only the portion of it. They might show only a few group of symptoms of the sora, but with which you can immediately find it out. The miasm lurking behind is the sora. Then it is the right thing with which you can approach, find it out, a right remedy. And if you are not getting such type of totality, chronic totality, in such types of cases, you can get it by investigating the sora, by investigating the fundamental cause. So, first important thing which you have to find it out is the ascertainable physical constitution of the patient, which denotes many a times a very clear indication about the remedy. The second important point is that his moral and intellectual character, which is also important to find it out. The third important thing is his occupation. The fourth is mode of living and habits. The fifth important is his domestic and social relations. Then next comes the his sexual function. That is the last one. Before that, the age, and then the sexual function. These are 7 important points which you have to take into consideration, with which you can find it out the fundamental miasm and you can reach to the patient. So this is very important aspect which he explains over there, and this you have to find it out. So in recurrent epidemic diseases, this is one thing which you have to find it out, the background behind those acute epidemic diseases is the chronic miasm, and that we have to treat with the remedy. Okay, so this aphorism where he wants to explain that if acutes are recurrent or if epidemic diseases are recurrent, why it happens so? It happens always because of the soric miasm lurking behind them. And that soric miasm is responsible to produce a disorder. And if it is so, you have to treat that with the proper antisoric remedy, that either denoted by the portion of the symptoms of the soric miasm in that patient, with which you can approach and we can find it out right remedy. And if it is not so, then you have to take into consideration all those 7 points with which you have to find it out the right remedy. So this is what he wants to explain over there, that if recurrent sufferings are there, this should be treated in such manner. There is some problem in the connection. I think everyone is not getting the clear picture. Are you getting it? Or are you getting the disturbances? Is it clear? The picture is clear, or is there any problem? Clear? No disturbance? And voice? Okay. So when you deal with the acutes, recurrent acutes, always think of the chronic miasm behind those acutes and treat that miasm. And generally, it is the soric one which you have to treat with the antisoric remedy. So this is the one more important thing which he has mentioned over there. Let us go with the next one, the concluding miasm of case taking, the 104, and there is one footnote to this paragraph is there. That also we have to learn. 104. When the totality of the symptoms that specially mark and distinguish the case of the disease, or in other words, when the picture of the disease, whatever be its kind, is once accurately sketched, the most difficult part of the task is complete. See what he is saying. If you get a very clear picture of the totality of the symptoms from the patient, then half of the work is done. Then everything is clear. Because your task of finding it out remedy becomes very clear if your totality is very clear. The physician has then the picture of disease, especially if it be chronic one, always before him to guide him in his treatment. So once you have written all those things, that record will be there forever, especially when you deal with the chronics with the further follow-ups. He can investigate it in all parts and can pick out the characteristic symptoms in order to oppose to these. That is to say, the whole malady itself, a very similar artificial morbific force in shape of homeopathically chosen medicinal substance, selected from the list of symptoms of all medicines, whose pure effects have been ascertained. So then the picture is there, the totality is there, then it is possible to choose a very right remedy on the basis of totality. You can go through that case, you can find it out what is complete, what is incomplete. If you feel something is incomplete, you can ask for it. You can find it out what is characteristic out of that with which you can approach towards the remedy. So a written record always helps you, and that's why it is necessary to write down all the details whatever the patient has explained, and those matters a lot. And last, to conclude what he says over there, and when during the treatment he wishes to ascertain what has been the effect of the medicine and what change has taken place in the patient's state, at this fresh examination of the patient, he only needs to strike out of the list of the symptoms, noted down at the first visit, those that have become ameliorated, to mark what still remains, and add any new symptom that may have supervened. So if you have this record in your hand, then it becomes quite easy for you for the further follow-ups. Whenever patient comes for follow-ups, you can find it out what symptoms have been vanished, which are still remaining, and which are new, which have appeared, so that you can write it down further. So record keeping is a very important entity with which you can get a thorough knowledge about the patient and which remains with you so that you can ask all the details regarding the patient's history and regarding the patient's complaints whenever he has been examined first time. So importance of record keeping, he mentions in this aphorism that it is helpful for the physician in order to find it out the characteristics from the case, in order to recheck the totality, in the further follow-ups to find it out which symptoms have been vanished and which are still remaining. All those things he can take it into consideration on the basis of record keeping. And that's why Hahnemann explained that every patient, whether it is chronic or acute, you should have your own records with you. So here completes the whole case taking, chronic case taking basically, started from the 83 aphorism till 104. Still, one footnote is there to this paragraph, which is related with this paragraph. Just we'll go through that footnote and we'll conclude the topic. What he says in that footnote number 99 or 90 something. The old school physician gave himself very little trouble in this matter, in his mode of treatment. Old school physician, they never keep the records. Specifically the allopaths, they never keep the records. He would not listen to any minute detail of all circumstances of his case by patient. Indeed, he frequently cut him short in his relation of his sufferings in order that he might not be delayed in the rapid writing of his prescription, composed of variety of ingredients unknown to him in their true effects. See what he is explaining. He would not listen to any minute detail. So what the patient is explaining, he will not going to listen in detail of the circumstances of his case by the patient. Indeed, he frequently cut him short in his relation of his suffering in order that he might not be delayed in the rapid writing the prescription. And this is the habit. They look toward the patient, they ask, what's your problem? They look to the patient, they ask the patient to open the throat, throw the light on it, find it out something, and immediately writes down the prescription. This is the specific method which is followed by the allopaths. composed of variety of ingredients unknown to him in their true effects. Variety of ingredients. What he word which he uses is variety of ingredients, because this is the complex prescription which generally they used to use, and this happens many times that they used to follow such type of prescription where the contents they used to use, they are not known, they are not proven or proved on healthy human beings, and still they are utilized. No allopathic physician, as has been said, sought to learn all the minute circumstances of the patient's case, and still less did he make note in writing them. So no one will going to ask what is your problem, what aggravated your problem, what are the causative factors, what ameliorates you. No details are required by them. On seeing the patient again several days afterwards, he recollected nothing concerning the few details he had heard at the first visit, having in the meantime seen so many other patients laboring under different affections. So whenever patient goes to the allopath again, he used to he cannot recollect because there is no record keeping. So, and in between, he has seen ample of patients, and that's why it was not recollected properly what the patient has explained at the first consultation. He had allowed everything to go in at one ear and out at the other. This is the method. So they listens from one ear and forgets from the other ear. At the subsequent visit, he only asked few general questions, went through the ceremony of feeling the pulse at the wrist, looked at the tongue, and at the same moment wrote another prescription on equally irrational principles, or ordered the first one to be continued in considerable quantities several times a day, and with a graceful bow, he hurried off to the 50th, 60th patient he had to visit in this thoughtless way in the course of that forenoon. So this is the method which you observe in many UPDs, how they approach. They approach like this. They just take the pulse, they just look toward the patient, they just see the tongue, just approach the patient and go on hurriedly prescribing the patient. They used to see in one session 50 to 60 patients. And how can they treat that patient completely? They can palliate, but they cannot cure because it is not possible. So this is the common thing which happens with them. The profession which of the all other requires actually the most reflection, a conscientious, careful examination of the state of each individual patient, and special treatment founded thereon was conducted in this manner by persons who called themselves specials, rational practitioners. The result, as might naturally be expected, was almost invariably bad, and 8 patients had to go to them for advice, partly because they were none better to be had, and partly for fashion's sake. What he is saying? He is saying that they call themselves as a rational practitioner. How can be the rational? They are not giving time to the patient. They are not listening what the patient wants to tell. They are not examining thoroughly the patient, and still they labels themselves by the name of rational practitioner. But still, patient goes to them, either because of 2 reasons. Either because of fashion's sake, that is the first thing, or second, there is no other choice. Better than none is the another important thing with which the patients approaches to them. And this is the difference between the homeopathic case taking and allopathic case taking. Homeopathic record keeping and allopathic record keeping. We used to keep the records in detail of the chronic cases, acute cases, so that for the next follow-up we know from what the patient has suffered earlier. But which is not the thing, especially when the things happens when you don't keep records. And that's the difference between the allopathic mode of approaching the cases and homeopathic mode of approaching cases, especially when you deal with the chronic. And here completes the thorough case taking as explained by Hahnemann, right from aphorism number 82 to 104. And this deals with the second first question, knowledge of the specifically how knowledge of disease and how to acquire knowledge of disease from the patient, that mentioned in the aphorism number 72. From tomorrow onwards, we have to start with the another topic that is related with the truth proving, right from aphorism number 105. So these are the very important things which he tried to explain in this. My suggestion to all of you is that go through those aphorisms again so that you can develop your own thorough case taking method and acquire a perfect way to approach to the patient. So that's all for today. I have a prior appointment somewhere, so it's not possible to continue the session today. We'll stop over here and we'll meet tomorrow at the regular time of 6 o'clock. Thank you very much for everyone. Thanks a lot.